Hey everyone, and welcome to the How To channel. Today we're tackling a topic that's crucial for everyone, finding affordable health insurance. We all know how important it is to have quality healthcare. But let's face it, navigating the world of health insurance can feel like trying to solve a Rubik's Cube blindfolded. In this video, we'll give you the tools and knowledge to find a plan that fits your budget and your healthcare needs. So grab your favorite drink, sit back, and let's dive into the world of affordable health insurance together. Let's be real. Finding affordable health insurance can feel like searching for a needle in a haystack. You're bombarded with options, overwhelmed by confusing terminology, and left feeling like you need a degree in insurance just to understand the basics. We'll break down complex concepts into easy-to-understand language and provide you with practical tips to navigate the insurance maze. Whether you're self-employed, between jobs, or simply looking for a better deal, this video is your guide to finding affordable health insurance that meets your needs and your budget. Okay folks, let's talk about why having health insurance is non-negotiable. Accidents happen, and illnesses can pop up when you least expect them. Without health insurance, even a minor health issue can turn into a major financial burden. Health insurance provides a safety net, allowing you to focus on your health and well-being without the added worry of crippling medical bills. So whether you're just starting out or reevaluating your options, let's explore how to find affordable health insurance that provides the coverage you need without breaking the bank. Alright, let's dive into some basic health insurance terms. First up, we've got premiums, deductibles, and co-pays. Think of premiums like your monthly membership fee for health insurance. It's the amount you pay, usually every month, to keep your coverage active. Then there are deductibles. This is the amount you have to pay out of pocket for covered medical expenses before your insurance starts pitching in. Once you've met your deductible, that's where co-pays come in. It's a fixed amount you pay for certain services like a doctor's visit or prescription drugs. Now, let's talk about networks. These are groups of doctors, hospitals, and other healthcare providers that have contracted with your insurance company to offer services at negotiated rates. Understanding these basic terms will help you compare plans and make informed decisions about your coverage. Section 2, Premiums, your monthly fee. Premiums can vary depending on several factors, such as the type of plan you choose, your age, where you live, and whether you're a smoker. Generally, plans with lower premiums tend to have higher deductibles, and vice versa. Think of it like this. A plan with a lower premium might be easier on your monthly budget, but you'll pay more out of pocket if you need to use your insurance. On the other hand, a plan with a higher premium might seem pricier up front, but you'll have lower out-of-pocket costs when you need medical care. The key is to find a balance that works for your budget and your anticipated healthcare needs. Section 3, Deductibles, paying your share. This is the amount you pay for covered healthcare services before your insurance company starts chipping in. Deductibles can range from a few $100s to several $1,000s, depending on your plan. Once you've met your deductible, your insurance company will start covering a larger portion of your medical bills, usually according to a co-insurance percentage. For example, if your plan has a 20% co-insurance, you'll be responsible for paying 20% of covered expenses, while your insurance will cover the remaining 80%. Some plans offer preventive care services like annual checkups at no cost to you, even if you haven't met your deductible yet. Section 4, Navigating networks, in or out. Now let's talk about networks. These are groups of doctors, hospitals, and other healthcare providers that are contracted with your insurance company. When you stay within your plan's network, you'll generally pay lower costs for healthcare services. However, if you go outside of your network, you might be responsible for a larger portion or even the entire cost of your care. There are different types of networks such as HMOs, health maintenance organizations, and PPOs, preferred provider organizations. HMOs typically have lower costs but require you to stay within their network for most services. PPOs offer more flexibility, allowing you to see out-of-network providers but at a higher cost. Alright, now that we've got the basics down, let's talk about you. Before you dive into the sea of health insurance plans, it's crucial to assess your own health needs. Start by considering your overall health status. Are you generally healthy, or do you have any pre-existing conditions? Do you see the doctor regularly or only when you're feeling under the weather? Your health history plays a big role in determining the type of coverage you need. If you have a chronic illness, you might need a plan with more comprehensive coverage, even if it comes with a higher premium. Next up, let's talk about family. Are you single, partnered, or do you have little ones running around? Your family size and their healthcare needs are important factors to consider when choosing a plan. If you have a family, you'll need a plan that covers everyone's medical expenses. This might mean opting for a family plan, which typically covers 2 or more individuals. Keep in mind that family plans tend to have higher premiums than individual plans, but they also offer more comprehensive coverage. It's all about finding the right balance between affordability and coverage for your loved ones. Now let's talk about everyone's favorite topic, money. Assessing your budget is crucial when choosing a health insurance plan. How much can you realistically afford to spend on premiums each month? Remember, your premium is just one part of the equation. You'll also need to factor in potential out-of-pocket costs such as deductibles, co-pays, and co-insurance. Take some time to review your finances, determine how much you can comfortably allocate to health insurance, and stick to that budget. Remember, affordable doesn't necessarily mean cheap. It means finding a plan that provides adequate coverage at a price you can afford. Last but not least, let's talk about the unexpected. Life is full of surprises, and not all of them are pleasant. When assessing your health insurance needs, consider your risk tolerance. Are you comfortable with a high-deductible plan that offers lower monthly premiums but could result in higher out-of-pocket costs if you experience a major medical event? Or do you prefer the peace of mind that comes with a more comprehensive plan, even if it means paying a higher premium? If you're generally healthy and don't anticipate needing frequent medical care, a high-deductible plan might be a good option. Ultimately, the goal is to choose a plan that provides adequate financial protection in case of an unexpected illness or injury. Alright, let's talk about employer-sponsored health insurance. If you're lucky enough to have this option, listen up. This is often the most affordable route thanks to the magic of group rates. Your employer negotiates with insurance companies to secure lower premiums for a large group of employees. Now, don't just blindly accept whatever plan your employer offers. Take some time to review the plan options, compare costs, and consider your individual healthcare needs. Now, let's talk about government-sponsored health insurance programs. These are lifesavers for millions of Americans, providing affordable healthcare options for those who qualify. First up, we've got Medicare, the granddaddy of government healthcare. If you're 65 or older, you're eligible for this federal program. Next, we have Medicaid, designed for low-income individuals and families. Eligibility for Medicaid varies by state, so check with your state's Medicaid agency to see if you qualify. These government programs are essential resources for millions of Americans, providing access to quality healthcare at an affordable price. All right, let's talk about the Affordable Care Act Marketplace, also known as Obamacare. This online platform is your one-stop shop for comparing and enrolling in health insurance plans. The Marketplace offers a variety of plans from different insurance companies, making it easier to find one that fits your needs and budget. One of the best things about the Marketplace is that it offers subsidies or financial assistance to those who qualify. These subsidies can significantly lower your monthly premiums, making health insurance more affordable for individuals and families. To see if you qualify for subsidies, simply enter your income and household information on the Marketplace website. Now let's talk about private health insurance. This is where you go it alone, purchasing a plan directly from an insurance company. While private insurance offers more flexibility in terms of choosing your plan and providers, it can also be more expensive, especially if you don't qualify for subsidies. If you're considering private insurance, it's crucial to shop around and compare plans from different companies. Look for plans with comprehensive coverage, a wide network of providers, and affordable premiums and deductibles. Private insurance can be a good option for those who don't qualify for government programs or employer-sponsored insurance. Okay folks, we've made it to the main event, comparing health insurance plans. This is where the rubber meets the road. When comparing plans, it's crucial to compare apples to apples, not apples to oranges. That means looking at plans side by side, paying close attention to the key factors that matter most to you. Remember, the goal is to find a plan that provides the right level of coverage at a price you can afford. Section 2, Coverage Check. What's included? First and foremost, let's talk about coverage. This is the heart and soul of your health insurance plan. It outlines what medical services are covered and to what extent. When comparing plans, pay close attention to the following: doctor visits, hospital stays, prescription drugs, mental health services, and preventive care. Remember, knowledge is power, and understanding your coverage options is essential for making informed decisions about your healthcare. Section 3. Network Navigation, Finding Your Docs. Now let's talk about networks again. Remember those groups of doctors, hospitals, and other healthcare providers we discussed earlier? Well, they play a crucial role in your healthcare journey. When comparing plans, take some time to explore the provider networks. Are your preferred doctors in-network? What about specialists you might need to see in the future? If you have a trusted physician or specialist, make sure they're included in the plan's network. Otherwise, you might end up paying more out of pocket to see them. It's also a good idea to check the plan's online directory or call customer service to confirm provider participation. Networks can change, so it's always best to double-check. Section 4. The Cost Calculation Crunching Numbers. Alright folks, let's talk about the bottom line: cost. This is often the deciding factor when choosing a health insurance plan. But remember, it's not just about the monthly premium. You'll need to consider all potential costs, including deductibles, co-pays, co-insurance, and out-of-pocket maximums. Take some time to calculate your potential out-of-pocket expenses for different scenarios. What if you need a routine checkup? What if you have an unexpected illness or injury? By understanding your potential costs, you can make a more informed decision about which plan fits your budget. Remember, the cheapest plan might not always be the most cost-effective in the long run. It's all about finding the right balance between affordability and coverage. Embrace the digital age, online tools to the rescue. Okay folks, get ready to enter the digital age of health insurance. Gone are the days of shuffling through stacks of paperwork and spending countless hours on the phone with insurance agents. We live in a world of instant gratification where information is just a click away. And guess what? Finding affordable health insurance is no exception. Thanks to the power of the internet, we now have access to a wealth of online tools and resources that can make the process of finding and comparing health insurance plans a breeze. These digital allies are here to simplify your life, provide you with personalized recommendations, and empower you to make informed decisions about your healthcare coverage. So, put on your tech-savvy hats, grab your favorite digital device, and let's explore how online tools can revolutionize your health insurance search. Healthcare.gov - your insurance ally. First up, let's talk about the mother of all health insurance websites, Healthcare.gov. This government-run platform is your one-stop shop for everything related to the Affordable Care Act, also known as Obamacare. Think of it as your trusty sidekick, guiding you through the ins and outs of the health insurance marketplace. On healthcare.gov, you can browse and compare plans from different insurance companies, estimate your eligibility for subsidies, and even enroll in coverage directly through the website. It's like having a virtual insurance agent at your fingertips, available 24/7. One of the coolest features of healthcare.gov is its personalized plan finder tool. Simply enter some basic information about yourself and your household, such as your income, age, and location, and the tool will generate a list of plans that meet your needs and budget. It's like having a personal shopper for health insurance. Section 3, Beyond the Basics, Third-Party Websites and Apps. While healthcare.gov is great, it's not the only option. Third-party websites and apps offer unique features and benefits. They provide personalized recommendations and connect you with licensed agents. Popular ones include Policy Genius, Health Sherpa, and eHealth. Compare plans, filter searches, and read user reviews. Explore beyond healthcare.gov. You might be surprised. Section 1. Wrapping up. You've got this. There you have it, folks. We've covered a ton of ground today, from deciphering insurance jargon to exploring different plan options and harnessing the power of online tools. Remember that feeling of being lost in a sea of confusing terms and overwhelming choices? Well, you've officially navigated your way out of that maze. You're now armed with the knowledge and resources to confidently find affordable health insurance that fits your needs and your budget. No more insurance headaches, no more feeling overwhelmed. You've got this. Pat yourself on the back for taking charge of your health and financial well-being. It's a big step, and you should be proud of yourself for taking it. Remember, choosing the right health insurance is an investment in your future, providing you with peace of mind and access to quality health care when you need it most. Section 2. Smart Choices, Healthy Life. Assess your needs, health status, family situation, budget, and risk tolerance. Shop around and compare plans. Utilize online tools like healthcare.gov. Knowledge is power. Understand health insurance to make informed decisions. Section 3. Stay tuned for more. And that's it for today's video on finding affordable health insurance. We hope you found this information helpful and empowering. Remember, taking care of your health and financial well-being is a journey, not a destination. So stay informed, stay proactive, and never hesitate to reach out for help if you need it. And hey, while you're at it, why not make life a little easier and hit that subscribe button below? That way, you'll never miss out on our latest videos packed with practical tips and tricks to simplify your life. And don't forget to give this video a big thumbs up if you found it helpful. Your support helps us create more content like this and reach even more people who are on their own journey to a healthier, happier life. Thanks for watching, and we'll see you in the next video.